So anyway, it is 6:30. So I would like to get started. Say good evening to everyone and thank you for coming. Sorry about the mix up in the Zoom links. This is class 3 of our nutrition acupuncture course with Dr. Robert Baritz. We've done all the introductions. I think we have one new person this week. So please sit back and enjoy. This is an interactive experience. Dr. Baritz will call to all of you with certain questions, and you put that in the chat box. If he asks, who here has ever had SP green food? And you can put in the chat box, I have, or I haven't. And then we have a Q&A box, which we address at the end of the class today, where you have questions about specific patients, supplements, or acupressure points that Dr. Baritz is talking about tonight. So I will turn it over to the doctor, Dr. Robert Baritz.
Hi. Well, today's webinar is on chronic fatigue syndrome. And, if you know anyone who's had it, or if you've ever had it, or if you've had a gradient of it, you'll know this is just a very unpleasant situation. A person feels betrayed by their own body. And I've got some family members that have had this, and I have some people that I know that I suspect have it, and they get all sorts of wrong diagnosis. So it was really a pleasure for me to research this and organize this material for you today. Chronic fatigue syndrome is a poorly understood condition. It's characterized by extreme fatigue lasting for 6 months or longer. Fatigue worsens with physical or mental activity. Fatigue does not improve with rest. Chronic fatigue syndrome cannot be explained by any underlying medical condition. This crushing condition can lead to worsening relations with others and even low self-esteem. Other symptoms of chronic fatigue syndrome are non-refreshing sleep, difficulty with memory, focus, and concentration, and dizziness that worsens upon standing. Now, sore throat, headaches, enlarged lymph nodes, and unexplained muscle or joint pains add into the picture. So I'd like you to just reflect for a moment and think about people you know that might have chronic fatigue syndrome. And if you know someone who might have chronic fatigue syndrome, just write, give me a note in the, give me a yes in the chat or a Y to show that you know somebody who might have chronic fatigue syndrome. Symptoms can fluctuate from day to day. The unpredictable nature of chronic fatigue syndrome disrupts work, family, study, and everything else in the person's life. I want to give you an example from my clinic. This was a 81-year-old male. He presented to the office in a wheelchair, accompanied by his wife and 2 other family members. About 2 years prior, he developed dizziness upon standing. I started him on a small program of adrenal support, and 6 weeks later, this is what his wife wrote for me. And I did put in the actual printing, so you might imagine that this is true. But over here, I put in the text. Thank God first and Dr. Baritz for the improvement I have seen in my husband. When I came to see Dr. Baritz, Ron was fainting and falling every time he would stand in severe dizziness. The improvement is amazing. Thank you, Dr. Baritz. God bless you. So I give this to you. Now I'm required to say that results are not typical, and typical results will be mild increase in energy and stamina. But if you do this program, you will get a huge number or a significant number of successes with your patients. It's almost unbelievable what you can do for this person. They come in They're at their wits' end. This particular patient, he'd been through the local physician. He'd been through the local hospital. He'd been to a major hospital in Boston. They could not solve his problem. That's why they brought him to the witch doctor. That's why they brought him to me. That's why this family that couldn't afford supplements and how to pay paid for this small program. They were desperate for results. You can produce results. And really, with the protocol that I'm going to give you today, it's likely you'll produce equal or better results than I have. Will you get 100%? Nobody gets 100%. But will you get better than your average chance? I believe you will. Just take it on faith. Try it with your first couple of patients. Make them stick with it. Now, this person got results in a couple of weeks. Make them give you 60 or 90 days. That's not a lot to ask. Typical medications, yes. Take those and we'll see how you do in 6 months. We're not going to ask 6 months. 30 to 60 days, 30 to 90 days, 2 weeks. Ask them to give you a chance. Give yourself and your patient a chance. Now, is this a mysterious condition? Well, Keith Worthington and I dug into the archives and he found the original 1920 paper where Dr. Raglan, a medical doctor, released his findings of what they call adrenal hypofunction. And see if this indeed matches what we today call chronic fatigue syndrome. What is it? It says right here. What it is, a screen test for hypoadrenia accomplished by measuring the body's ability to compensate for the hydrostatic effects of gravity. What does that mean? Gravity pulls water down. Water is level in a bowl. It doesn't stand up. So when you're laying down, the heart is pumping, but it only has to pump enough to send the blood to the brain. But when you stand up, the water has to pump uphill like a spring. So it has to pump harder and fight the hydrostatic effect. The water is static and it fights the effect of pushing the water up. What it may indicate: hypofunction of the adrenal glands, cardiovascular efficiency. Well, we understand that. How efficient is the heart? It's an objective measure of diagnosing the aesthetic syndrome. Look it up in the dictionary. Aesthetic means weakness. Aesthetic syndrome. And what is it characterized by? Weakness, dizziness, and he even calls it chronic fatigue. Unheard of. He pre-diagnosed chronic fatigue, which we haven't heard. It then disappeared from the, or never made it into the coin of the public coin till 20 years later. So how can you run this test on your patients? I'm glad you asked. Now, this is actually a medical test, and they call it the postural hypotension test, and sometimes it's called the tilt table orthostatic test. Okay, have the patient lay on their back supine for 4 minutes. Take and record the blood pressure and pulse. Then pump up the cuff again and have the patient stand. Take the pressure immediately upon arising. If you have them stand and then repump up the cuff, it will be too late to catch it. Optimal, as you know, the pressure would rise because the heart has to push the blood uphill. If it rises above 10, the body is hyperreacting, and in a few months or years, it will then hyporeact. If it drops, if there's a rise of 6 or below, or the blood pressure actually drops, then they have true postural hypotension. So what do you give them? Adrenaline? Steroids? Not if you're in my practice, not if you're in your practice. We use lifestyle management and certain supplements and acupuncture points that I'm going to give to you in just the next few minutes as we speak. So, support natural systems, eliminate inflammatory foods, wheat, caffeine, chocolate, and dairy. Have the patient try for 8 to 10 hours sleep per night. Disengage from electronic devices after 9 p.m. That means turn them off. Don't leave on the cell phone in the bedroom. Start preparing for bed between 9 and 10 p.m. Prepare the room to be as dark as possible with no electronic devices except a battery-powered travel clock, because the battery doesn't produce enough energy to affect the individual, the sensitive individual. And reduce or eliminate heavy food consumption in the evening. Now, I've created for your patients and for you a little 5-6 page guide that covers everything I'm going to cover in our workshop. And you can simply print it and hand it to your patients, or email it to your patients. Over here, of course, you can click to get to the video you're going to see. This is the acupuncture point, a location guide, talking about the terms we have to use, anterior and posterior, proximal and distal, and what is a sum, and how do you measure it, the very smart Chinese proportional inch. And then these are the chronic fatigue points. We'll cover those in some depth. And these are the supplements. This is, again, a study in simplicity. Only 5 supplements with 3 additionals and the reasons why you might want to take them. Over here are the lifestyle recommendations we just went over. And over here is the disclaimer to help patients understand that this is not a medical treatment. So let's take a look at some of those supplements. The first one is calcium lactate tablets, 2 tablets twice a day. They support muscle contraction and nerve conductivity. They help maintain healthy bone density and remodeling. They contain a 5-to-1 ratio of calcium magnesium that's considered to be the sweet spot, or the Goldilocks spot of calcium to magnesium ratio. Supports the immune system, part of a healthy diet along with physical activity, and I recommend strength training, and it may reduce the risk of osteoporosis. Next is Protofood, 2 twice a day. Supports protein metabolism and immune system response function, as well as skeletal and muscular health. If you have noticed that your patients with chronic fatigue syndrome have flabby muscles or a weakened body, just give me a note in the chat box, say F for flabby. Ferrofood, 2 twice a day. Maintains healthy blood, provides iron, which is essential for synthesis of hemoglobin, and helps deliver oxygen to red blood cells, and contains vitamin C to help with absorption. You know, this is another reason I always reach for a standard process supplement. Not only are they giving you the iron, but they provide just the right amount of vitamin C so the patients can absorb it. If you have patients who've been taking iron supplements, or you've tried iron supplements yourself, you'll know that the dreaded constipation is just a few days away. They give them high dose iron and the constipation follows. Now, when you give them Ferrofood, the amazing thing is that it's low dose iron, but because it's in this whole food juju, the way standard process designs it, it goes in, and I got to tell you, my patients, you know, they've been sent to me by their medical doctor says, look, you have to take iron. They come to me, what shall I take? I say, try this. They go, it's low dose. I know, try it. I don't know why it works. And you know what? When they get their blood test, 8 out of 10 times, the iron is going up. So you got to try this product. It's just amazing if a person has clinical, blood test proven low iron, or if they're a menstruating female, they're losing a lot of blood, or if they have chronic fatigue syndrome. Adrenal desiccated, 3 twice a day for 1 to 3 months. This provides powerful short-term adrenal support for immediate energy needs. And this was a key component of the program that I gave to that patient I mentioned earlier on. Now, this is not a long-term product because it doesn't rebuild health. And we're all about rebuilding. We support the patient and then we backfill with rebuilding. Desiccated adrenal just gives them support, but it is not the end. You want to replace this after 2 to 3 months with Drenamin, and we're going to talk about Drenamin now. So basically, you're going to bring them through the tunnel of fatigue and into the new vista of new health. Drenamin, 4 twice a day on an empty stomach. Starts after adrenal desiccated, promotes healthy adrenal gland function, maintains energy production, supports a balanced mood, encourages a healthy response to everyday environmental stressors, supports immune system response function. There are tons of adrenal supplements on the market today. You cannot go into a health food store, online, Amazon, anywhere, and blink twice without seeing an adrenal support supplement. But there's none of them like this particular product here, which has a great, unique formulation. I could spend the whole half hour talking about Drenamin, but I leave it to you to consult with your standard process rep to get the inside dope on this miracle product. Okay, that's it. That's the protocol. Also consider adrenal complex to help reduce the effect of periodic stress. So if the person has these, they're stressed, but if they have the extra, really worse stress, this is the one you want to give them 1-3 times a day. They can suck on it like a stress tab. I have people in executive meetings, they just pop them like candy and suck on that tablet through the meeting, calms them down. Cardiotrophin PMG, 4 twice a day on an empty stomach, supports the heart, supports the cardiovascular system, and helps them rebuild those flabby muscles with strength training. It promotes the effect of strength training. Okay, Cataplex B Core, 2 twice a day, supports energy production, supports the nervous system, supports the cardiovascular system, and supports healthy homocysteine levels. Homocysteine levels, what's that? Homocysteine is an amino acid. Vitamins B12, B6, and folate break down homocysteine to create other chemicals your body desperately needs. High homocysteine levels back up, and it means you may have a vitamin deficiency. Without appropriate nutritional supplementation or medical treatment, elevated homocysteine level increases an individual's risk for dementia, heart disease, and stroke. So do yourself, do your patients a favor, give them Cataplex B Core twice a day if they show any signs of needing energy support while you're on this program. Okay, Adrenal Chronic Phytosynergist, 1 teaspoon twice a day, stress and sleep support in liquid form for your patients who like liquids. Now, let's take a look at the acupuncture points that have been shown for thousands of years to help patients with chronic fatigue syndrome.
Hello. In the next few minutes, I will show you how to find and activate the top acupuncture points for chronic fatigue syndrome. Chronic fatigue syndrome is characterized by extreme fatigue. If you are dealing with fatigue that worsens with mental or physical activity and doesn't improve with rest, you might have chronic fatigue syndrome. Difficulty with memory, focus, and concentration are often part of the chronic fatigue syndrome package. There is no clear cause for this condition, and it often lingers for years, disrupting lives, families, and income. Fortunately, the safety and effectiveness of acupuncture for helping people with chronic fatigue syndrome has been proven in numerous studies. A searching review of these studies has isolated the top acupuncture points for chronic fatigue syndrome. In this video, I will show you how to locate and activate 3 of the top acupuncture points for chronic fatigue syndrome. My name is Dr. Baritz. I'm a chiropractor, nutritionist, herbalist, and I'm certified in acupoint physical medicine. I've helped thousands of people live better naturally, and I want to help you too. If you like this information, please give me a thumbs up, subscribe, and hit the bell icon to be notified when more videos come out. The first point recommended for chronic fatigue syndrome is stomach 36. Stomach 36 is known as leg 3 miles. This interesting name points to the energy-boosting properties of this point. It is said that in ancient China, when peasants were so exhausted that they couldn't take another step, they would rub this point and their energy would increase to such a level they could then walk another 3 miles. In addition to helping with fibromyalgia syndrome, stomach 36 is used to reduce leg pain, weakness, numbness, burning, and tingling. Stomach 36 is also used to regain balance and coordination. In addition to helping with fibromyalgia symptoms, this remarkable acupuncture point is said to strengthen the body, boost the immune system, and strengthen the digestive system. Stomach 36 is perhaps the most frequently used acupuncture point of all times. To locate stomach 36, place the tip of your index finger just below your kneecap. Then find the point just in front of your pinky finger. Press in there to find a tender spot. It might be slightly higher, slightly lower, or to the left or right. That is stomach 36. Activate stomach 36 by rubbing this area 5 times. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. Now locate stomach 36 on your other leg and repeat. I've put a link below for more information about the Tei Shin that I recommend. After activating stomach 36, stand up, walk in place for a minute, and really lift your legs. Notice if you feel more energy. Chronic fatigue syndrome is a complex condition and may involve digestion and the immune system. The point that I will introduce today is the amazing governing vessel 20. Governing vessel 20 is known as 100 meetings, signifying its effect on all the systems of the body. In traditional medicine, governing vessel 20 is said to soothe the liver, expel evil spirits, and release cramps. In Western terms, we know that governing vessel 20 is the most powerful acupuncture point for neurological conditions. Interestingly, governing vessel 20 seems to work on both ends of the body, in the head for headaches and dizziness, and in the pelvis for hemorrhoids, rectal, and uterine prolapse. To locate governing vessel 20, place the tips of your thumbs on the tops of your ears. Then bring your index fingers together. Governing vessel 20 is at the midpoint. You may notice a slight indentation at that point. Activate governing vessel 20 by rubbing the area quickly 5 times, then take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. The final point I'm going to cover today is conception vessel 4. Conception vessel 4 produces whole body effects and is an important point to treat fatigue. Conception vessel 4 is said to restore the body after collapse and has been used as a complementary treatment for stroke, coma, and physical or mental collapse. Conception vessel 4 is used to help women with problems associated with menstruation and infertility. For men, conception vessel 4 has been used to help with male sexual dysfunction and prostatitis. Conception vessel 4 is located the width of 4 fingers below the umbilicus. To locate conception vessel 4, place your hand just below your umbilicus. Center your index finger so that the first joint is just below your umbilicus. Then press into the spot that is just below your pinky finger. Depress the superficial tissue and press in to find a spot that is tender or painful. That is conception vessel 4. You might have to search slightly higher or slightly lower. Activate conception vessel 4 by rubbing this area quickly 5 times. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. Now take a few deep breaths and stretch from side to side. Your pelvis just might feel a little more alive. If you are dealing with extreme fatigue, complicated by poor sleep, and difficulty with memory and concentration, I suggest that you use these points 3 times a day for the next 30 days for fast relief. And then simulate these points 2 times a day for the next 90 days to continue progress and stabilize results. And check out my video, Chronic Fatigue Syndrome Recovery, for more natural remedies. These acupuncture points have been helping millions of people over thousands of years. I encourage you to give them a try. It is my wish that they help you live a healthier and happier life. Till next time, this is Dr. Baritz signing off, yours, The Health Natural.
Okay, so that completes the presentation, and I'm ready to answer any questions you might have.
All right. Well, there wasn't a whole lot in the Q&A box, but there's a bunch of stuff in the chat.
All right.
Did you end up explaining the aesthetic?
Yes, I believe aesthetic. I believe I did.
Yeah.
Aesthetic comes from asthenos, the Greek, and it means
Yeah.
really weakness. And so I think I covered that. If
Right. So this is very important for everyone who's on. Please put your questions in the Q&A because we have to scroll back in the chat and we can't determine what's been answered or not if you use the chat box. So the Q&A box is the correct box for the questions.
all right, Ben, I've just accessed the chat box. I'm just going to quickly go down there. If there's a question, I'm just going to try to answer it.
Yeah.
Let's see.
There,
Did you have someone?
I was just. All right, you can start if you want to do it that way.
Explain how the results of to interpret the results of the Raglans test. You just want to take the look at the blood pressure. I think I might have covered that, but if the blood pressure should rise between 6 to 10 points on the patient stands. If it goes above 10 points, it means that the adrenal glands are in a state of hyperfunction and they need to be supported before they collapse. And if it's below 6 points, 6 to say 0 point rise, then it's in sort of a transitory low function. And if it actually drops, they're into full clinical hypoadrenia, and that's when they really need a heavy support. Flabby as I get older. Well, yeah, we all get a little flabby as we get older, but we need to fight it every step of the way by doing strength training twice a week, covering all the body parts or the major body parts. And you can do that in one session, repeat that twice a week, or you can do half the body in one session, half the body in the next session.
Okay.
6 tabs equal 1 tablespoon of powder of calcium lactate. I believe that's correct. Ben, you can correct me.
There's 500 milligrams, I believe, per tablet, and there's 10 grams in a tablespoon. So more likely so it's like 10 tablets. Like a tablespoon is the equivalent of 20 tablets.
But is that 20 of the old style tablets or 20 of the new ones?
No, the new. Wait, yeah, new tablets 500, right?
Yeah, I think the new.
Yeah,
I
sorry
think
about
it's
that. The new
10.
tablet's
So it's a
500.
10 new tabs, 10 tabs to the tablespoon.
So it's 20, right?
I don't think so.
500 milligrams.
I'll let you do the math.
20 is 10,000, which is 10,000 should be 10 grams, right? 1,000 milligrams. Well, I can work on this. Go to the next one.
All right. So, let's see here. Mark spoke to everyone. Flabby. I had a patient who could not tolerate adrenal complex due to licorice. Yes. Body aches and dizziness likely from depleted potassium. Any suggestion as to knowing who can and who can't use it? She was only on a small dose. No, it's one of those trial and error things. But if they can't handle it turns out they can't handle it, that's when I give them organically bound minerals. And I would use 2 to 4 times the dose on the bottle of the organically bound minerals if they can't handle the adrenal complex. In your video, it looks like you're too close to the tibia for stomach 36. Yes, I am a little too close to the tibia when I pressed it with my finger. I'm hoping that the people who watch will look at the diagram. What's the alternative name for conception vessel 4 and governing vessel 20? I'm going to take Pinyin Chinese so I can give you that. But just to do that now, conception vessel 4. Conception vessel 4 is known as gate of origin, and it's Guanyang, Guanyang, Yuan, excuse me, Guan, Guan, Wang, Yuan. And governing vessel 20, 100 meetings, that is Baihui, Baihui. Very interesting. And Baihui, by the way, is found on the dog between L5, the L6, or the lowest lumbar, and the sacrum. And if you have a pet dog and you run your finger down their back along the lumbar vertebra, just before you get to the sacrum, there's going to be like a little spongy area. That's the Baihui 100 meetings points for the dog. And what you want to do is you want to scratch that spot. The dogs will love you for it. Anyhow, a little piece of trivia. On the human, that is the top of the head. On the dog, the Baihui point is right there just in front of the sacrum. You'll make a lot of dog friends that way.
I'll just jump in. It's of the brand new tablets, 13 of brand new tablets equals 1 tablespoon of the powder.
Thank you, Ben.
You get a lot for your money there.
Yeah, I'm so glad they reformulated that. What is the relationship of the thyroid to chronic fatigue? Chronic fatigue overwhelms the thyroid, leading to hypothyroid, and the hypothyroid can contribute to chronic fatigue. Don't forget, it's a poorly diagnosed condition, so we don't know all the linkage.
Great.
4 fingers equal 3 sum. Yes, 4 fingers at the first knuckle here equal 3 sum to get to CV4, conception vessel 4. Okay, so that is that. Let's just take a look what's in the Q&A now.
Yep.
We did the adrenal complex. What is your reference book for acupuncture points? And I'm just holding this up here. This is a textbook, and I'm using Pictorial Atlas of Acupuncture. It's a beautiful beautifully, fully illustrated book produced by H.F. Ulfman and edited by Hans P. Ogle and Wolfram Sohr. There's a huge, the Germans really are interested. They've really taken acupuncture, Western acupuncture, to the next level, and this is where they produced this book. Is protocol for hyperadrenal function the same as hypo? Typically, you do not give them the desiccated adrenal. They don't need that, and I don't think that's going to be good for them. You would go straight to the Drenamin. So I think now I've cleared out the chat and the Q&A. Is there anything else we need to address?
We're in great shape. Thank you so much. And we look forward to this next Tuesday. So you all have the link for next Tuesday, but you will get an automated link next Tuesday and for everyone on tonight. And you also have the link for next Thursday, Carrie Bone. But anyway, thank you for joining us. We'll have the recording up. Yeah, no, it's 13 of the new tablets equals 1 tablespoon of calcium lactate powder. It used to be like 28 or something. But now, you know, we more than doubled the size in the calcium lactate tablet. So you're getting 300 milligrams per 3 and go into 10,000 or 10 grams with 10,000 milligrams of calcium lactate powder per tablespoon. So the powder is incredibly, you know, economical. All right. Well, thank you, Dr. Baritz. We will see everybody next week and look forward to it.
Great. Good night.
Good night.